What does an adult psychiatrist think about L-Theanine as a supplement for mental health? My name is Dr. L-Theanine. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent. But what about when it comes to supplements, which we're not prescribing and there's not necessarily the same evidence for? So one of the questions that's come up is L-Theanine. Is this a safe and/or effective supplement for mental health? So L-Theanine is an amino acid that is found in tea leaves. It's primarily used to promote relaxation and improve sleep quality, but it can also be used to enhance focus and cognition. There's also some thought that it may be neuroprotective, meaning that it helps to protect brain cells from age-related damage. And it may also help to reduce heart rate and blood pressure responses to anxiety. And it does all of this with theoretically not causing drowsiness. It's usually going to be available in a capsule in about 100 to 400 milligrams, or in tea in about 5 to 40 milligrams per cup. Most studies that we have on L-Theanine are looking at 200 milligrams. And because it doesn't cause drowsiness, you can either take it in the morning to help with stress, or you can take it in the evening for insomnia. Now, like most supplements, we don't have tons of data on the safety or efficacy of this supplement. It seems to be relatively safe, even at pretty high doses, but we also don't have data on long-term use or good randomized controlled trials to show whether or not it is as effective as some of our prescribed medications. Some relatively rare side effects could include things like GI upset, like nausea, vomiting, stomach upset, diarrhea. Sometimes there can be side effects like headaches, dizziness, lightheadedness. And even though for some people it can be helpful for sleep and for cognition, for others it can cause like a brain fog and it can make it more difficult to get to sleep. We call this a paradoxical reaction. As far as safety and interactions with medications, because it can decrease the blood pressure, it is important to keep in mind for people who are on blood pressure medications, it could potentially get too low and cause dizziness. And although in and of itself, it doesn't tend to cause drowsiness, it is a CNS depressant. And so if it's combined with other CNS depressant medications, like other anxiety medications or sleep medications, then it could increase the risk of drowsiness. And we also don't have data on its safety and use with breastfeeding or pregnancy, so we don't recommend taking it if you're in one of these categories. But what about you? If you've had an experience with L-Theanine, either good or bad, I'd love to hear about it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.